Did your nurses see warning signs of your baby's distress? Did they hesitate when they should have acted? Labor and delivery nurses are on the front lines. They are the ones that are watching your baby's heart rate. They are monitoring contractions, and they're making sure that everything is going the way it should. But what happens when a nurse sees a problem and does nothing? Here's the truth. Some nurses will recognize fetal distress, but they don't immediately push for action. And there could be many reasons as to why nurses would do this. Hospitals have what we call a chain of command, and this is a process that nurses are supposed to follow if they believe that a doctor isn't acting fast enough. But here's the problem. That process is only as good as the people who are willing to use it. Some nurses, they don't fully understand how to escalate their concerns. Others will hesitate because they trust that the doctor will do everything that they're supposed to do and that the doctor will handle it. And then you have some nurses that are afraid to push too hard because they don't want to be seen as someone who is challenging authority. Meanwhile, your baby may be in distress. Their heart rate may be dropping, late decelerations could be showing up, and contractions may be getting too strong or they're getting too close together. All of these things could be signs that your baby's oxygen supply could be in danger. And this is where delays will happen. This is where delays begin to work their way in. Maybe your nurse was concerned, but instead of escalating, they waited. Maybe the charge nurse was called, but instead of stepping in, they trusted the doctor's decision on everything. And then the result, more time is passing, more oxygen is lost, and now there's more risk to your baby. Now let's take some time and let's talk about the records. When families look back, they often assume that everything happened in labor and delivery and that everything was written down. But that's not always true. Sometimes what's missing in the records is just as important as what is actually in the records. Were there repeated concerns about heart rate patterns, but no signs that anyone escalated the care? Was there documentation of a charge nurse stepping in, or was there just nothing at all? If no one used the chain of command, that could be a problem. And here is what families need to ask themselves. Did the nurses truly act as their baby's advocate, or did they wait and hope that the situation would get better and it would just fix itself on its own? Because waiting is not a plan. And in some cases, it is the reason why babies can suffer an HIE brain injury or a subsequent CP diagnosis. Again, I'm Marcus Boston, and if you have any questions about your baby's HIE brain injury at birth or subsequent CP diagnosis from a medical legal standpoint, don't hesitate to reach out and contact me. You can find out more information about me in my profile. If you're on certain apps, you can send me a DM, or you can just wait and watch the picture that follows the rest of this video. All right, that's going to be it for this morning's quick educational video. Have a great day, everybody.